Someone collapses in a crowded space. They are unresponsive. They aren't breathing. From the moment they hit the ground, a silent countdown begins. For every minute that passes without intervention, their chance of survival drops by 10%. This is sudden cardiac arrest. While often confused with a heart attack, the medical reality is different. A heart attack is a plumbing problem caused by a blockage. Sudden cardiac arrest is an electrical failure that stops the heart entirely. A heart's internal electrical system suddenly scrambles. Instead of a coordinated contraction, the heart muscle quivers uselessly, a state that immediately halts the flow of oxygenated blood to the brain. This creates a survival gap. In the United States, the average ambulance takes 7 to 10 minutes to reach a patient, but without blood flow, irreversible brain death begins in just 3 to 5 minutes. For most of the 20th century, the only solution was this: a massive, heavy hospital defibrillator. These machines required professional medical training to interpret the patient's heart rhythm and manually select a power level. Surviving cardiac arrest is a matter of geography and timing. To bridge that 5-minute deficit, medical intervention has to happen exactly where the victim falls, long before the ambulance arrives. The Automated External Defibrillator, or AED, is a high-speed diagnostic computer purpose-built for the lay public. It automates the entire medical decision-making process, allowing a bystander to perform a complex clinical intervention. The AED searches for erratic waveforms like ventricular fibrillation. These are shockable rhythms. It will refuse to shock a flatline, since there's no electrical activity to reset. For a shockable rhythm, it delivers a biphasic shock, clearing erratic signals to restart a normal heartbeat. Before delivering that energy, the AED measures the patient's chest resistance. It uses this data to calculate the exact therapeutic dose of joules required to penetrate that specific patient's chest wall safely. This internal programming makes it impossible to accidentally shock someone. The machine only arms the shock button if its analysis confirms that the patient's heart is in a specific, shockable state. By shifting the burden of diagnosis to the computer, the bystander is freed from medical uncertainty. Their only role is to follow the machine's lead. The protocol begins the moment a collapse is identified. You check for a pulse, call 911, and immediately begin chest compressions. CPR does not restart the heart, but it buys time. By physically compressing the chest, you are manually pumping residual oxygen to the brain to keep the cells alive until the AED is ready. Once the AED is retrieved, you simply turn it on. The Luis prompt will guide you to bare the patient's chest and apply the adhesive pads exactly as shown in the diagrams. The hardware is designed for any patient. If the victim is a child, rescuers use specialized pediatric pads or a toggle switch on the machine that automatically lowers the energy dose to a safe level. To encourage action, all 50 U.S. states have passed Good Samaritan laws. These provide legal immunity to bystanders, ensuring that anyone acting in good faith to save a life is protected from liability. Because a victim in cardiac arrest is clinically dead, there is no risk of making the situation worse. In these 5 minutes, the only true mistake is doing nothing. Expanding scope, public safety experts now use the 3-minute retrieval rule to build our societal safety net. The goal is to place AEDs in gyms, offices, and airports so that a device is always within a 90-second walk of any emergency. This push for accessibility has led to new mandates in schools. Roughly 23,000 children experience out-of-hospital cardiac arrests every year, often during athletic events, making on-site defibrillators a critical requirement for student safety. The remaining challenge is the last mile, reaching residential neighborhoods or remote areas where an ambulance still cannot beat the 5-minute clock. In Forsyth County, North Carolina, a new clinical trial is testing a futuristic solution. When a 911 call reports a cardiac arrest, the dispatcher launches an AI-enabled drone that flies to the GPS coordinates and drops an AED directly to the bystander. This data shows the impact of that speed. While the baseline survival rate for cardiac arrest is only 10%, that number jumps as high as 70% when a bystander uses an AED before the paramedics arrive. Resolving. In the mall, the rescue is a success. The bystander followed the prompts, the machine delivered the shock, and the victim is breathing on their own as the EMS crew takes over. The life you save could be a friend, a family member, or a stranger. Locate the AEDs in the buildings you frequent and share this video to help others understand the power of the 5-minute override.